Hey guys, I'm Taylor and I'm a labor and delivery nurse, and I want to tell you 5 things that I personally would not do as a labor and delivery nurse. Number one is drink castor oil. If you don't know, castor oil, which I believe is like a vegetable oil, sometimes people drink for its laxative effects to help them go to the bathroom. But some people drink castor oil because old wives' tales say that it helps you go in labor. Sometimes what happens is you drink castor oil, it makes your intestines have basically contractions to move the stool along, which then in turn irritates the uterus and can cause you to have contractions. But in my experience, I've seen people come to labor and delivery with just explosive diarrhea and not actually go into labor. Or I've seen people go into labor and have explosive diarrhea the whole time. Number two, and this one might be a little bit controversial, I would never get a membrane sweep. If you don't know, some providers will do a cervical exam where they basically separate the amniotic sac from the uterus wall slightly, and there has been some research that says that it's safe and effective to help you go into labor. But why will I not do it as a labor and delivery nurse? And that is because time and time again, I have seen providers do membrane sweeps and patients come into triage in labor and delivery and they are in this prodromal, very uncomfortable labor for days, but they don't actually go into labor. Do some people go into labor? Yeah, maybe. There's some evidence on it, so look into it. That's your decision. But I would never want to be one of those uncomfortable people contracting for days but not actually going into labor. Number three, I would never refuse the glucola drink for the gestational diabetes screening. I, as a labor and delivery nurse, obviously believe in research, and research has shown that the glucola drink is safe and effective. It's a one-time drink, and we know anything in moderation is safe. It has been proven safe and effective to have during pregnancy, and I, as a labor and delivery nurse, have seen the devastating effects that gestational diabetes has had on the pregnant women and on the fetus themselves. So I personally would prefer to know and be able to take care of myself and my baby rather than refuse a one-time drink. Number four, I would not have unnecessary cervical exams during labor. When your water's broken, the more cervical exams you have or the more things that go into the vagina, the rate of infection increases. Now, with that being said, we use cervical exams as an important part of the labor process, but I would sit down and I would ask myself, is this cervical exam going to change our plan? If the answer is no, you probably don't need it. Now, if the cervical exam is going to change a plan in your labor and you think it's necessary, go for it. Great, it can be a useful tool. But this is a good question to ask your provider so you two can decide if you feel like you really need it or not. Number five, I would never create a birth plan that has no room for changes. As a labor and delivery nurse and as a mom of 3 boys, I know that your labor and delivery experience does not always go as planned. So if I were going to create a birth plan, I would make sure that it accounts for some changes because you never know what could happen. My ideal birth plan accounts for my preferences, but also accounts for the fact that I don't know exactly what's going to happen during my labor and delivery, and sometimes we might have to steer from the path we originally chose for ourselves.